The next CQM that we're going to cover today is documentation of current medications in the medical record. This one is a little bit more straightforward than some of the other ones that we looked at. The description of the measure is the percentage of visits for patients age 18 years or older for which the eligible professional attests to documenting a list of current medications using all immediate resources available on the date of the encounter. This list must include all known prescriptions, over-the-encounter medications, herbal, which means vitamin, mineral, dietary, nutritional supplements, and must contain the medication's name, dosage, frequency, and route of administration. So in order to do this, we must go into the medication module. So the medication module is located on your history toolbar, and it is the RX icon. So we can see that this patient does currently have a list of medications that they're on. They have 2 active meds and 1 inactive med, but for fun, let's just put in a new medication for today. So we can do that by pressing the Prescribe New button, and we could select a med from the Practice's Favorites list. These are actually based on the provider whose name is selected at the top of the screen, but the practice can push them out to all providers so that you start off sharing the same and most common lists. So we're going to do one in the search window, and I'll type in Lipitor. And then let's select the 20 milligram tablet. Maybe I'm also speaking with a patient and they told me that they also like to take aspirin. So it is an over-the-counter med, but as the measure states, we need to include all medications that the patient is taking. So I entered in 2 medications without having to leave the medication search window. If you want to add more, you can, but in this case, we're going to say that these are the only meds that the patient is on. So we'll press the select button, and now they're listed as temporary meds. So in order to make them active medications, we must review a few things first. So the first thing that we're going to look at is the SIG. So this SIG says take 1 tablet by oral route 1 time every day. According to the Joint Commission, they like you to be a little bit more user-friendly or patient-friendly when discussing the SIG. So instead of saying by oral route, I'm going to update this to by mouth so that it's a little bit more easy for the patient to understand. And press the Done button. We will pretend that we are prescribing this med, so I could type in a quantity of 30, and today could be my start date, and I can be finished with that and then press the Accept button. But maybe the aspirin was not something that I recommended the patient take and somebody else did. I will still update the by oral route to by mouth. And I'm going to also state that this was prescribed elsewhere. And accept. So now I have 4 active meds and 1 inactive med. I am going to close out of the medications module and go into a template now to show you how the nurses can go through a medication reconciliation. We'll open up the intake template and select our family practice as the specialty and office visit as the visit type for today. So the medication reconciliation can take place in the intake screen, and it is located in the medications section. So within here, we can see all of the active medications that are on the patient's record. If there was nothing changed today, we could say no medications this encounter, or if the patient did not have any medicines. But we're going to run through a medication reconciliation. So let's click on the Reconcile button. I will select at the top that a manual medication reconciliation was completed, and maybe we reviewed this with the patient. So I'm going to go through here and just select self. There are other options that you can select if maybe a patient's guardian helped go review it with you, or maybe they had a list of medications, but for our case, we're just going to select self. Let's then look at the medication review. So at this time, the nurse or medical assistant would ask the patient if they're taking these meds. So let's do a review, and we would ask them about the first one, and maybe they said yes, they are taking it. So we could say taking as directed. Maybe they are also taking the aspirin, taking as directed, and the Lipitor, taking as directed. But maybe they take the Suboxone not as regularly, or maybe they stop taking it. I could click in this list and make a change to how the patient's taking it. This isn't actually going to change anything in the medication module. It is just a note that will be placed on the medication so that whenever the doctor comes in, they will be aware of what the patient says that they're doing. So maybe for this med, we're going to say the patient is unsure, and then we'll click on it, and you can see that it does put a note next to it in the medication review. So from here, I can just press the OK button. And what happened was the medications reconciled checkmark was checked. And at this time, the nurse's job is complete as far as the medication reconciliation goes, and it would be the provider's turn to come in and review the patient's med list with them.